You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, everyone. We're back at Stellar Success Podcast with your host, Dr. Tudor Franco, and I have an interesting guest tonight, someone who's on the other side of the healthcare perspective from a regular physician and who can provide us with some other types of points of view, I would say, about how things are done and how things should be done. Louis Marshall from all the way from New York. How are you doing?
I'm doing fine, Tudor. Thank you very much for having me this evening, and I look forward to our discussion.
Absolutely. I'm interested in your points of view because you're someone who is in that I would say business regulatory management position. And can you tell us a little bit about your story? How did you start, where the life went with you and where are you now?
Oh, sure. I'd love to. I'd love to. So thank you very much. So I did my training at Harlem Hospital, which is not far from where I am now, and began a primary care practice in Queens, and was taking care of patients and realized I could do a great job taking care of one patient at a time. But over time, started thinking about how could I improve the health and care of more people, more than one at a time. And so I started thinking about my my goal of doing that and how could I get there. So my goal was to get involved in health policy and management and to really get involved in the regulatory side of medicine and helping to make the rules. Because back then there were very few physicians in politics, right? So I thought that would be a good route for me. So in conjunction with that, I also felt that I could improve the care of others, multiple people, by also getting leadership positions within hospitals. And so my first real leadership position was associate chair of emergency medicine at a hospital in Queens. And I could improve the health of the patients that came there by helping to make policies and procedures to provide standard of care in the emergency department. After many years of then thinking about how I could do more, I then became medical director for the New York City Fire Department for the Bureau of EMS. And that really gave me an opportunity to help standardize the care in the pre-hospital arena for all of New York City. And that was really something that I was really happy to do to help set policy and procedure as well as clinical guidelines for our pre-hospital medical providers. From there, I got involved in statewide committees. One was the New York State Emergency Medical Advisory Committee, where I chaired the Medical Standards Committee for about 18 years. Sorry. And what that allowed me to do was to take all of the pre-hospital protocols across the state and through the committee, guide the committee to developing a single set of statewide protocols. So when I first started in that role, there were 18 regions across New York State, and each region had their own set of protocols, right? So each region was a little different. And so over the 18 years, I was able to bring people together around the table and actually help standardize care across New York State. So it really gave me an opportunity to really affect the care of millions of people. And so that was my journey up to that point. And then I decided to go back into the hospital setting. And I held different hospital leadership positions in emergency medicine up until chairing level 1 trauma center emergency rooms in New York City. And then started thinking about, my career and my education and what would I need to really propel myself to a leadership position. And so I was very, very thoughtful about, what I wanted to do and how I wanted to get there. So I went back to school and I got a master's in health policy and management because that's really where I wanted to be, was in the regulatory realm. And so I needed to learn about healthcare regulations and policy and how to write policy and how to write regulation. That was at NYU. And during that time, one of my professors said, Lou, if you really want to go into healthcare regulation, you should go to law school. And I'm like, but I don't want to be a lawyer. But after thinking about it for a couple of years, I went to law school and I really learned about healthcare regulation. And finishing law school coincided with my position at the New York City fire department, EMS. And so that law degree with the medical degree really allowed me to get into the healthcare regulatory arena, not only at the local and state level, but I was also invited to participate at the national level on a negotiating rulemaking committee. And that committee was set up to establish the ambulance fee schedule for Medicare patients. So again, it allowed me to really affect the care of millions of people. And so that's my that's my story. Most recently, I took on a role right in the middle of COVID at Lincoln Hospital here in the South Bronx as the chief medical officer. And Lincoln, as you know, is a 360 bed level one trauma center. And I think we have the third or fourth busiest emergency room in the country at this point. But I've always tried to be intentional about what my next steps are. And when I mentor people, I also share that with them is that to be thoughtful and intentional about where you want to go next, right? You don't have to predict 20 years from now, but where do I want to go next? What's my next leadership role, right? So I was assistant director of emergency medicine. And so my next goal was to become chairman of emergency medicine. And then the next goal was to become chairman of emergency medicine in a level one trauma center where they had a training program. So, step by step, I was able to intentionally plan, my career and then identify what education I needed to get there. So most recently during COVID, I set my sights on my next level, which might be it's hospital CEO. And so I thought about what did I need to prepare myself to know or have the skills to do. And so I decided to go back and I got my MBA during COVID, which I call my COVID degree. And that was, it was fun. I learned a lot. I know a lot more now about managing hospitals from the financial perspective. And so it's been a really great ride for me. And I think that as I mentor young physicians, even here at Lincoln, I meet with all the residents and I tell them, start thinking about what your career is going to be. You're going to spend 10, 15 years clinically, and then you may want to do something else. So start thinking about what that something else might be so you can actually plan for it, right? So yeah, that's how I got to where I am. And it's been a great ride so far. And hopefully my next challenge will come true as well.
Yeah, this is an amazing story, and I congratulate you for all this accomplishments and degrees. And it's really something for a doctor to be a lawyer also and an MBA, and deal with the complexity of issues that you deal with right now. What I'm interested in is because I hear a lot of my colleagues, right, from our perspective, from the practicing physician perspective. The thing that probably is on the front of the questions is how can hospitals and healthcare establishments have the right kind of policies and protocols in place to satisfy both the side of practicing physicians in direct patient care and also make the place more efficient, because that's what it's all about, right? It's all about the bottom line numbers. Everybody's looking for that to be profitable, to make money, but you cannot do that without the right protocols and procedures in place. And that's the good part of it. But the bad part of it is that a lot of those protocols and procedures are having I would say a negative impression out there in the healthcare world. How do you see this thing going from your perspective?
So before I answer that, I'll just give you a little more background. So I also have had a primary care practice in a community in Queens for many, many years. So I understand, the interplay between the physician, the clinical physician, and the community and the hospitals that we go to, right? And so I think that as a hospital administrator now, what I need to do is I need to involve these community physicians in terms of, what are their goals and what are their needs to take care of their patients? And then working on the hospital side, as you mentioned, how can we make things more efficient, right? And thinking about efficiency, I also think about quality, right? Because looking at my feeling is that if we practice quality medicine and we provide quality care, then all those other things will follow. We can develop the efficiencies. The quality of care with good patient outcomes will help the bottom line for the hospital. It will also help the physician as well in terms of their work and make their work easier. And I think that, we've seen so much burnout, since COVID that and the implementation of electronic health records that really just takes a lot of our time as clinicians. And how can we streamline that? How can we utilize medical assistants or patient care technicians to do a lot of the upfront work so that we as physicians can actually spend that 20-minute visit with the patient and not spend that 20 minutes, taking a smoking history or family history or doing a medication reconciliation. We have coworkers and other team members that can help us with that, and that will help us be more efficient as well. So,
yeah, it's Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now. It's very important. I think the protocols and procedures, this is something that many people kind of oversee. There has to be a department or, a team who puts them in place. I come from a specialty that it's very, I would say, strictly regulated in a way. I'm an anesthesiologist. So if we don't, we practice, that's why it's called standard of care, because we practice after certain very clear steps, procedures, and protocols in our daily practice. And most of the time, people don't realize that those things need to be in place in every single healthcare establishment. And I would definitely, congratulate the fact that, coming from you as a physician with a physician background, it's very important for all these establishments to have physicians in roles that can write those protocols and procedures, and not somebody who doesn't have the clinical experience in the background. Because I think it's very important for practicing physicians to have that kind of experience before they start writing protocols and procedures, especially in hospitals. And most of the time, I think people think of hospital administration and, protocols like some kind of a big monster out there in the sky that, looms over you and looms over the staff and pressure everybody to do the same thing or, and it's not. I think it's, like you said, it's a mode to make the place efficient, safe, and, patient care centralized. How do you work with people around you in a team? What is your daily activity to create those kind of things in your department?
So I think one of the things that I've learned is that, we need to involve our frontline providers in developing policies and procedures. We all, leaders within hospitals and healthcare systems always talk about developing standard work like you were talking about, right? Policies and protocols that you follow based upon your specialty. And I think that here in my role, what I've been able to do is really bring together the departments and allow them the ability to develop the protocols and policies that they need to operate their own departments, right? I'm not here to dictate to anybody, what anesthesia should do or what trauma surgery should do. You know better, you're the expert. And one of the things that I've been, talking about recently is really deference to expertise, right? So in high reliability, we have a deference to expertise. And it's not by title or role, it's by the person who's the most expert in that area. So anesthesia, for instance, as you know well, nobody can tell anesthesiologists what their protocols or procedures should be because we're not anesthesiologists. And same for other specialties. So I think that being able to bring these groups together and allow them to help develop their policies and procedures and bring my background in regulatory issues and to that discussion has helped them. And where we can, we do interdepartmental policies and protocols so that, we always talk about practicing in silos and how do we break silos. So wherever I can bring multiple departments together, to develop a protocol. I'll give you an example. So right now, what I'm trying to develop is we have a lot of cancer resources here at Lincoln. So we have medical oncology, surgical oncology, we have GYN oncology, and a few others. And so, my vision would be for us to bring all of those groups together and form one cancer line of service, right? And then utilize all those resources so we're not siloed in the cancer world. And so that's something that I've brought together the surgery and the medicine department for initial discussions. And then we'll bring together everybody else and we'll start mapping out a vision, not necessarily my vision, but if there's buy-in, then the vision of the group. And then we can put together the policies and the procedures and the protocols so that we can manage these patients, effectively.
Yeah, yeah, that's a great approach. So, Louis, tell us a little bit about your personal approach to your journey. Like, what do you think the habits and routines that you have get the most credit for your success right now?
So I think physical health is important, right? And that's key for me. But also taking time and meditation to allow yourself the opportunity to think about what you're going to do, what you want to do, and how you're going to get there. I've actually brought some of that here in our morning operational huddles. At the end of the 30-minute huddle, we've been doing mindful meditation for the last 2 years. And we just take a minute or two, and it's guided meditation. And I think it makes people feel good. And I think is what has helped me is physical training as well as meditation. And really just giving yourself time to think about issues, right? Because a lot of times, especially in physicians, we're making decisions quickly, with maybe not all of the information that we need. So we really have to sometimes step back. And that's what I tell people, step back, take a deep breath, think about it, and then think about what the options are.
Yeah. Um, I'm sure, along the way, you probably had a lot of things that didn't go your way or setbacks. Can you give us an example of such a thing that kind of took you back a little bit more and kind of make you realize that you need to go forward a lot stronger?
Yeah. So I have two examples. One is my personal experience. Well, they're both my personal experience, but I was working in a hospital emergency room. This was back in the mid 90s. And I was I was very angry for some reason because I didn't feel like the right care was being provided to patients. And there was one instance where I kind of was a little louder than I should have been with one of my colleagues. And I was actually let go. And that was a devastating blow because, I mean, we all think we're doing a great job and we think we're doing good, but obviously, that wasn't the appropriate thing. But I learned from it, and I learned really how to control myself, even if I'm angered or upset. And I can always talk calmly to people now, which has been something that's helped me tremendously. And I try to share with some of my colleagues here who I've had to counsel about their loud voices and interactions with others. So that was one. That was really a setback, but it made me think about how I can move forward in a better way in terms of both, where I wanted to go as well as my personal behavior, right, in professional settings. And so that was really something that helped. The other lesson that I learned was, and this has to do with allowing frontline staff to participate in developing policies and protocols. So this was here at Lincoln, and we wanted to develop, myself and the chief nursing officer, a good interdisciplinary rounds process, right, on the med surg units. And so she and I sat down, we developed a plan, we scripted it out, how what to say to the patients and the patient families and what information the doctors and the nurses should be sharing during this interdisciplinary rounds on the unit. And we piloted it on one unit. And the first day, it was a total flop. And it was a total flop because we didn't involve the frontline staff. It was just leadership coming up with, oh, this is a wonderful idea. Do this. And they were like, nah, it's not working. So that was a good learning experience for me. It's not that I didn't know that before, but that really brought it home. It's like, I can't make the decision. Even as a leader, I need to involve the frontline staff who are the experts. They have the expertise, and they actually went back to the drawing board and they came up with a wonderful interdisciplinary rounds tool, and they've been doing it. And it's helping us to meet our goals of discharges before noon and all of those other criteria that we look to meet in hospitals. So
Yeah, that this is very interesting because sometimes, some of the best ideas come from people that are, the frontline people, and then they go up to the leadership and they come back to them in a form that motivates them more. So I think it's a cycle, right? That
yeah.
it comes back to them and makes the thing successful. So, Louis, what do you think about the challenges that you have right now this year? Like, what's coming up for you? What are you excited about, and what do you think is going to be a challenge?
I think for me here, one of my biggest challenges is really going to be helping to increase access, right? Lincoln Hospital while we have a huge number of square footage, our our model is limited, and our ability to expand outside of our four walls is limited. And so really, how do we create more access for patients when we can't increase the space, right? So I can bring in additional doctors, but if I have no place to put them to see patients, then that's not helpful. So that's going to be our big challenge going forward. I think that, we do have plans to, build a nice ambulatory pavilion, but, that's 5 years away and millions, hundreds of millions of dollars. So right now we're looking at expanding hours beyond the normal 9 to 5 that most hospital clinics would operate. So we have evening hours in most of our areas, including dental, primary care. We've extended our hours for express care, which is kind of like fast track, but not part of the ER. We've added pediatrics to express care to offload some of the pediatric ED patients that come in that don't need emergency department care, and that's starting to help. But those numbers are still small, and it's really about how do we educate the community that these resources are available. So that's going to be my big challenge. I think from a quality perspective, we're providing good quality care. We don't always document great, but we're working on that as well, and that's another challenge that I've been working on since I got here, and that's gotten a whole lot better. But really, improving access is really one of our biggest challenges, and one of our missions is, right, how do we improve access to the population that utilizes Lincoln Hospital?
Yeah. With all that you know right now and your experience in so many different fields and your studies, if you would look back to yourself when you started this whole thing, what kind of advice would you give to yourself?
Um, I would give the advice that I give to young doctors now, is to get involved in things outside of your comfort zone. Like, get involved in hospital committees that you know nothing about. Learn about different specialties. Learn about different processes, and then start to volunteer to help. And once people see that you're willing to work with them and learn, then I think you can grow. A good example for me was, at one hospital, I decided to join the revenue cycle committee because I thought that maybe I should know what revenue cycle is about. And I learned quite a bit. And I also learned how important it is what we do as physicians on the front end, how massively that can affect revenue cycle in the back end for the organization, whether it's a general practice or group practice or a hospital. It's really about what we as providers do on the front side. And I learned that by going to revenue cycle meetings, which I knew nothing about. And then I became the physician expert on revenue cycle and could go back to the docs and translate to them. All right, here's the revenue cycle. This is what it means. And here's why it's so important that you do A, B, C, D during the visit. So volunteer, get involved in other things, outside of your specialty, especially if you have thoughts of perhaps being an administrator or having a larger role within an organization at some point. I think that that's really crucial to help you learn. And you don't have to go to school, right? It's not that somebody has to go get another degree. I mean, I happen to, but it's not required. But learning about other areas of the organization, I think, are.
Yeah, that's a great advice. Um, I think in general, many more physicians and healthcare workers in general should get involved in the administrative part of hospitals and surgical centers and clinics, because I think we need more expertise from inside to reflect the admin part of it and the way things are structured, and protocols are written and procedures. Um, we need more people to get involved, because I feel like this is one field that many physicians ignore
Mhm.
and avoid, um, and I think should be exactly the other way around. They should get more involved, like you said, volunteer, get out of your comfort zone if you don't like this stuff. I think it's more important to get a lead from within us as a community, as a medical community, to get leaders like yourself, to kind of get a new trend, a new vision, more appropriate, I would say, to what the medical community wants in general. Um, Thank you very much for being here, and I hope all your projects are going to be successful from now on.
Thank you very much. Thank you for having me, and it's been great speaking with you.
I appreciate it.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.